Very interesting. Following in Benny Prim's footsteps certainly was challenging in many respects. Number one, he's a legend. I mean, how can you come behind a legend? Number two, quite frankly, whenever you have transitioned from someone who's been in a position for 40 plus years, there are a number of culture issues that are really based on his approach. And as much as I revere him, I am no Benny Prim. I try my best to be a good, hopefully many people say so, Lawrence Brown. Well, we've done a number of things in terms of responding and building on his legacy. One of which is the fact that we've actually emphasized training. We've underscored the need for us to continue what it differentiates us from other nonprofits, and that is clinical research. Third, we've come around to talk about things that mostly affect the way our very professional and very dedicated staff to do their work. So we have re-examined things to make things easier for them so that they don't just work hard, they actually work smarter. And finally, we've put into place things that you might say let their head down, allow them to enjoy and appreciate each other by restoring things that they've come to be used to, like our corporate picnic or holiday party. But more importantly, and I think they would like this, is the fact that we've been able to restore bonuses. The best things about our treatment program are the fact that we have one of the most dedicated, the most proficient staff that there exists. These are staff who, in many ways, you might say, but for the grace of God, they would be our patients. We have a very, racially and ethnically diverse staff, and they will do things beyond the call of duty to respond to the needs of our patients. For example, many of you know about Hurricane Sandy that was in our neck of the woods. They came in despite the absence of public transportation, despite the fact that the weather was terrible, yet they made sure to maintain the continuity of care. These are young men and women who, in fact, I believe, represent the leaders for tomorrow. At the same time, there's a partnership here. They have demonstrated their investment and aligning with our agency's culture for the future. So we as an agency have to, in fact, meet our part of that investment to make sure we assist them in so doing. EMR medical records have been superb. They've allowed us to do a number of things. First, it allows rank and file staff to demonstrate the work they've done in a more timely and a more effectively way. Second, it allows the managers to know where they have achieved superbly and where there is a need for further improvement. Most importantly, it allows us to meet our, you might say, our 5 major corporate objectives, one of which is regulatory compliance. We can see remotely how well we're doing. We can look at our productivity, the quality of care we render, how we satisfy the patients that we provide care to, and finally, how it provides support to the staff, how they feel about the use of the equipment. And in fact, we've done a great job of monitoring this over time. Since 2006, we've been able to monitor each of those 5 different objectives. I believe that the chances of successes with full parity, meaning treating persons with addictions the same way you would treat someone with heart disease or diabetes, I think the prospect for that is greater now than it has ever been in my life. But it really will take more work. It will take work from persons like yourself, like me, to make sure that our public servants appreciate why we believe that's important. And I don't believe we have enough people who have the message and who are effective messengers to deliver that. So from time to time, we have these threats in terms of forestalling that progress. So it is going to take us to be able to say, how do we get rid of pre-existing exemptions? I mean, How do we make sure persons with a substance disorder can be treated for as long as necessary to help that person achieve sobriety, rather than having these artificial and arbitrary time limits? So it's going to really take, you might say, as we say in my neighborhood, it's going to take a community.